Hello students. Last session was about RBC and WBC disorders. Today we'll be discussing about the leukemias, about acute leukemias, and the next session will be on chronic leukemias. So this is the normal bone marrow blood stem cell which gives rise to myeloid stem cells and the lymphoid stem cells. So the myeloid stem cells, again, they get differentiated into myeloblast, and then the myeloblast give rise to the granulocytes. What are the granulocytes? Eosinophil, neutrophil and basophils. And also these myeloid stem cells differentiate into red blood cells and platelets. And the blood stem cell, they differentiate into myeloid and lymphoid stem cells. The lymphoid stem cells give rise to lymphoblast, and from the lymphoblast they differentiate into three types of lymphocytes. So the B lymphocytes, the T lymphocytes and the natural killer cells. So all these, the myelocytes and the lymphocytes together, they are called as the white blood cells. So the blood stem cell in the bone marrow gives rise to the red blood cells, platelets and the white blood cells. So now let's know the definition of leukemia. So what is leukemia? It is a group of malignant disorder affecting the blood and the blood forming tissue of the bone marrow, lymph system and spleen. So what is the etiology? So the etiology will be combination of predisposing factors including genetic and environmental influence, chronic exposure to chemicals, radiation exposure and cytotoxic therapy. So on the left side you are seeing a normal blood smear picture, and right side the leukemia picture. So in the last video we discussed about a normal blood smear. So here you can see the red blood cells, the neutrophils, the platelets and the monocytes. The monocytes are the largest WBCs in the peripheral blood smear. On the right side you can see this bizarre large cells with large nucleus with irregular nuclear membranes. So these are somewhat abnormal cells. So these cells are called as the leukemic cells or leukemia cells. Moving on to acute leukemias, the first one is acute myeloblastic leukemia. So AML. AML stands for acute myeloblastic leukemia. So how does this myeloblast appear on a peripheral blood smear? It's a large cell with round to oval nucleus with fine chromatin and 2 to 4 nucleoli. So how many nucleoli does it have? It has 2 to 4 nucleoli with scanty cytoplasm with fine granules. So they are large, round to oval nucleus with fine chromatin, 2 to 4 nucleoli with scanty cytoplasm and fine granules. So these are called as myeloblast. And also the most important feature in acute myeloblastic leukemia are the OR rods. So always when we focus slides for practical spotters, we focus the OR rod with other abnormal myeloblast for you to easily identify it as acute myeloblastic leukemia. So in the cytoplasm you see crystalline cytoplasmic inclusions. These are nothing but the azurophilic granules which has clumped together, and they appear as needles like structures which you call it as OR rods. So acute myelogenous leukemia. So how do you interpret the smear? So once you see the smear on the microscope, means when you confirm it as acute myeloblastic leukemia by looking at the OR rods, then you start writing about the RBCs, WBCs and platelets. So always remember, comment on the RBCs, WBCs and the platelets. So RBCs are always normocytic normochromic type of anemia. So there is anemia, but it is normocytic normochromic. There's nothing to do with the MCV. So it's not microcytic hypochromic because there is no iron deficiency. It's only the leukemia which is causing the abnormal WBC, abnormality in the WBC. So the WBCs, you see multiple myeloblasts, more than 20%. So how many myeloblasts should you see to call it as acute myeloblastic leukemia? More than 20 myeloblasts. So the myeloblasts are abnormal cells, so may contain several fine rod-like structures called the OR rods, and these are seen only in acute leukemias of myeloid differentiation. So normally in the bone marrow you see the myeloblast, but you don't see the myeloblast in the peripheral smear. Only when you have a malignancy leukemic condition you see the myeloblast in the peripheral smear. And the platelets, they are moderate to severe thrombocytopenia. What is thrombocytopenia? It is reduced count of platelets. This is a case study. 25-year-old man, male with a history of recurrent upper respiratory tract infection with fever, nausea, submandibular swelling for several months prior to admission. He had noticed that cuts on his hands did not heal well. So this is another clue. And the patient had fever with recurrent upper respiratory tract infection, and physical examination there was no organomegaly. So RBC count is reduced. It is 2.7 million. For a male it is reduced, very much reduced. Hemoglobin is mildly reduced. It is 9.9. Hematocrit 28%. MCV is 106. Maybe it's a little bit increased for the normal value. Then WBC neutrophil only 4% and lymphocyte 16%, monocyte 1%. So they have commented about the abnormal cells. So abnormal cells was 79% and platelet count was only 50,000. So you can see a peripheral smear stained with Leishman stain. So this will be asked in your question, Viva question. So what stain they have used? It's a Romanowski type of stain. It's a Leishman stain. So when you see this picture, you can see a large cell with slightly indented nucleus, and in the cytoplasm you can see very scanty cytoplasm, a needle-like structure. So that is called as a OR rod. And also in this field, the platelet count is reduced. So what describe the peripheral smear, the additional investigations, and what is the likely diagnosis? So the peripheral description will be shows predominantly normocytic normochromic RBCs with minimal anisocytosis. There are 3 blasts having large nucleus with finely dispersed chromatin and 1 or 2 nucleoli. So it can be up to 3 to 4 nucleoli. So one of the blasts contains a needle-shaped azurophilic inclusions. These are the cytoplasmic inclusions. So I'm repeating it again. So what is an OR rod? It is a cytoplasmic inclusion. They are the lysosomes or the azurophilic granules which has clumped together to form an OR rod. So it inclusion in its pale blue cytoplasm and platelets appear reduced. So what are the investigations you do? Bone marrow examination, immunohistochemistry, so the peroxidase and the esterase. PAS are the immunohistochemical studies you do, and cytogenetic studies. What is the diagnosis? It is acute myeloid leukemia. So this is a picture showing a large cell with large irregular nucleus with 1 or 2 nucleoli, and in the cytoplasm you can see 2 needle shaped structures. They are called as the OR rod. So this case is acute myeloid leukemia. So this is how you draw the picture in your exam. So draw the large cell with 2 to 3 nucleoli, large cell with OR rod. Moving on to the next case, it is acute lymphoblastic leukemia. So this leukemia arises from the lymphoid precursor cell. The previous one which you saw was the myeloid precursor cell. This is from the lymphoid precursor cells. So how does lymphoblast appear? So lymphoblasts are large cells with round to oval nucleus with coarse clumped chromatin. So they have coarse clumped chromatin, and the cells are large, round to oval nucleus, coarse clumped chromatin with inconspicuous nucleoli and scanty cytoplasm. You can see only 1 or 2 nucleoli in lymphoblasts. So acute lymphoblastic leukemias, RBCs are normocytic normochromic type of anemia. WBCs are increased in count with more than 20% lymphoblasts will be seen. So the same thing which you saw in AML. And lymphoblasts are larger cells with high NC ratio, that is nuclear chromatin ratio is increased with condensed chromatin. They have a coarse chromatin and absent to inconspicuous nucleoli. So you have 1 or 2 nucleoli. And platelets, it is reduced. So there is thrombocytopenia. So this is how you draw the picture. So you can see the lymphoblast, the L3 stage of the blast, microcytic hypochromic RBCs. It is not necessary that you should see microcytic RBCs in case of leukemia. There can also be normocytic normochromic RBCs. And the WBCs are increased in number. What WBCs? Predominantly the lymphoblasts. So how does a lymphoblast appear? They are large cells with scanty cytoplasm, large nucleus with coarse chromatin, 1 or 2 prominent nucleoli, and the platelet count is always reduced. There is thrombocytopenia. So there are 3 subtypes of ALL. So what is the classification we use? We use the FAB classification. So L1, L2, and L3. So L1, you have small uniform cells, nucleoli regular and with condensed chromatin, inconspicuous nucleoli and scant cytoplasm. And L2, the cells are much larger, heterogeneous cell population. Nuclei is irregular, clefting will be there with occasional nucleoli, mild to moderate cytoplasm. So the indented nucleolus you see in L2 stage. And L3, it's large cell, homogeneous cell population, nucleus regular with fine chromatin and 1 or 2 nucleoli, moderate to abundant vacuolated cytoplasm. So L1 small cells, L2 large cells with indented or clefted nucleus, and L3 large cells, homogeneous cell population with abundant vacuolated cytoplasm. So this is a stage, L1 stage, L2 and L3. That finishes with the acute leukemias. So next session will be on chronic leukemias. Hope you all understood about leukemias and stay safe. Thank you.